Hi guys, hope you're doing good. So hope I'm audible and the screen is visible to you. Or sees. I need a quick response on the chat box so that we'll proceed with the half an hour. Okay. Suggestions regarding how to restart or how to start. Okay. I know that most of you are done with your internships and planning to restart and give a decent attempt of 2025 NEET MDS. Okay. I know that you are clueless regarding the date, regarding the approach and everything. So this is a very simple plan, like spending 1 day or 1.5 day or 2 days with each subject. It was well organized and everything. Okay. And a proper sequence and everything I'll be discussing here. This will be useful for the students who are about to restart or who has recently restarted the prep, or this is useful for the students who are not able to touch that 400 500 mark till the date, okay, because of your different approach of reading. So all those people come under this category. So please do respond me in the chat box so that we can start the proceedings. Yeah, good evening one and all. Yeah, nice to see you all. Tomorrow I'll be in the offline center. Okay, so all offline students. I think it was a week. Okay, tomorrow I'll be sitting in the offline center. I'll be coming at morning around at 10 o'clock. And I hope my voice is clear, the screen is clear, streaming is clear, so that we can proceed the plan. Uh, Please do respond me as quick as possible on the chat box. Right. Good evening, all of you. And we have a few questionnaire also. If there is anything required, we'll discuss regarding the preparation or XYZ, except the date of exam. Okay. No one can predict the date of exam. Whatever sources you have, you cannot predict the date of exam. Okay. It is completely unpredictable, which we have discussed in many lives. But what is predictable in the script is how you approach from now, at least from now. Okay. It's not mandatory that everyone has to read everything. Okay, but how smart you read from now, that is more important. Even if you're doing good, how smart you have to read from now, how you need to uh, like attempt the GTs, how you need to revise, how you need to manage this negative marking, and how you need to manage the negativity that is going around you. Okay, let it be social media or let it be anything XYZ. Okay, so those things are more important. Okay, those things are playing very crucial role in the last couple of years, and I hope that is everything is clear. I think we already had 110 or 150 115 students are there. So chalo, let's start. So first disclaimer of this session is, okay, so this is more useful for the students who are not done with the syllabus properly. Okay, this is more useful for the students who are not done with the syllabus properly or who are not confident, who are about to restart. Okay, because in the last couple of days I got so many messages. Even in the morning I was talking to 3 or 4 of the students. Okay, at to restart. Okay, how many days are left or how to approach. Okay, it is completely clueless because we don't know the exact date of exam. So we are clueless like how to start. So this video is exclusively for those category of students who has not started the preparation, okay, till the date, or who are not clear in what they're doing, that they're reading randomly but they're not clear in what they're doing, or who are halfway halfway into the preparation but clueless. Okay, and who are not able to get at least this 400 500 scores even after giving so many GTs. Okay, I know it is going to be a few people then can easily crack this, few people are not able to crack this. Reason can be XYZ. As of now we cannot analyze the reason, but the main motto being a mentor is I'll try my best to improve your scores. Okay, because it's all about, the game is all about like how better you perform in the final exam with a unoverloaded preparation. Okay, less load preparation. Okay, even if you read vigorously, whether it's going to give you a score or not, I'm not very sure. Okay, I'm not very sure. Okay, if you are not able to hit that mark, okay, means even working so hard, you're not able to touch that 400s or 500s at least in the worst situation, then I strongly recommend you to follow this particular checklist for you guys. Okay, well organized videos and everything are there on the website, because everything I have kept very nicely. Okay, and all these PDFs were already shared onto your group, so please do take the printout of the PDF. All the Mdsconquer students, I strongly recommend you to take the printout of the PDF. Okay, for example, like you start, my strong recommendation is start with module 1, because module 1 is comparatively easy. Module 1 is more often a clinical. Module 1 is a scoring, like you read, you understand. So once you are done with module 1 subjects, okay, because they're easy to understand, easy to score, so you gain that required confidence. Okay, once you gain that required confidence, I think you can easily drive into the next module. So that is my main motto of keeping module 1 easy, cool, and composed. Okay, right. I hope you guys are very, very clear regarding this. Right? Okay, right. So, right. So these are the main things before you start this particular video, and I want you to take the printout of this properly, file it, and nicely. Like for example, you have 5 videos exclusively on the quick revision and boot camp, okay, of Endo. So make sure you clearly write down, okay, this is done. Like once you're done with this, write down it is done, or you clearly keep a timetable for this. Okay, clearly keep a timetable. For example, I told most of the subjects, I'll give you a rough idea when I'm talking about each and every subject. Okay, most of the subjects can be done in 1 day or 1.5 day. Okay, except few subjects which requires 2 days or 2.5. As of now, we don't have the tentative date. So my suggestion is I want you to finish these things as quick as possible. Okay, few subjects on a daily basis, 1 day. Few subjects you can go with 1.5, and few subjects they may require 2 to 2.5. Okay, and subjects like oral path and oral medicine as a combined subject. So you consider oral path and oral medicine as a single subject. That subject may require more time. That subject may require more time. Or for example, like in my schedule, your general medicine physiology as a combined subject. So that subject may require 3 days, by which I'm splitting 1.5 day for oral path and 1.5 day for oral medicine, or I may giving 3 days for general medicine and physiology revision. So that is 1.5 plus 1.5, and all the topics whatever I have covered in the videos and whatever I have covered, particularly if I'm talking in the videos, or particularly if I'm talking in the exams. Okay, exams here are not, okay, exams here are not to test your scoring. I still seeing few of you reading something, giving exam, and feeling bad for your low score. Exams are not here to test your knowledge or analyze your knowledge, because it's an open secret that your preparation for a particular subject is 1 day or 1.5 day. So don't expect extraordinary results in the exams. And the main mode of asking you to give a subject specific exam, the main mode of asking you to give a subject specific exam, because reading books like Dental Pulse or reading books like Dentist cannot be possible in 1 day or 1.5 day. It's an open secret that everyone has to know. Okay, so my main mode, main motto is, like for example, if I'm keeping an exam of 120 MCQs, okay, 120 MCQs, my main concern is telling that these 120 MCQs or these 120 concepts, or along with that explanation part, is important for exam, whatever that is being covered in the quick revision. For example, five videos are there. Okay, each video roughly around like 20-25 minutes or 30 minutes. So you have roughly around like 2.5 hours of classes of Endo. It may not cover the entire syllabus, but it is going to cover the major aspects of your final exam. It is going to cover the last 10 years concepts which are very frequently repeated. The most common areas are being discussed in the videos in the most simplest way. And even the subject specific exam is always covering the most important areas. Okay, so my main concern is not to test your knowledge. My main concern is to have a smart reading, a smart prep in this leftover days. This smart prep in the leftover days can give you better results, can give you better scores. Right? Clear guys? I hope you're very, very clear. So chalo, I'll be starting what to be done. So first one is I'm jumping into module 1. I told you the module 1 is the easiest module. So module 1 is the easiest module. Module 1 is more clinical module. Module 1 is more clinical module, and module 1 is going to increase your confidence. Okay, so spend proper time with module 1. Module 1, apart from scoring, apart from easily turning the pages, easily finishing the videos, easily finishing the exam, it is going to give you confidence, which is most important required. So first module is a easy clinical confidence module, means module which is going to improve your scores. So jumping into the first subject, endo, okay, operative and pedo are most comfortable subjects according to most of the aspirants who are preparing for the entrance exam. So what my suggestion is, we have 5 quick revision videos. I want you to finish the quick revision videos. If you're not done previously, if you're already done, yeah, it's okay. If you're already done, if you're not scoring good, again, I want you to recheck. Now, how to make a notes. Is notes required? My suggestion, yeah, notes may be required. Rather than notes, contents are more important. For example, in quick revision video, endo part 1 is there. Okay, so now take a notes. Okay, write down quick revision endo part 1. Now while you are checking the video, while you are going through the video, understanding the concepts, I want you to write down the contents of the video. For example, if Ellis classification is, I don't want you to write entire Ellis classification. I want you to write heading Ellis classification. So what are the contents? For example, if you want to revisit a particular thing which is already discussed in the boot camp, then your contents of the video, because quick revision and boot camp together will be around like 100 plus videos on the website with an unlimited watch for all of you. Okay, so I want you to write down the contents of the video. Sometimes you may require to write more. For example, there is a syndrome, you cannot write the content of a syndrome, so now you write down the short form of the what is the triad that is present in the syndrome, what is the main concern with the syndrome, is there any chromosomal abnormality, any such things. If you want, you can write down. Okay, so don't write classifications, don't write heavy things. Okay, for example, if Ellis classification is discussed at 12 minutes 30 seconds in the video, write down the release classification, underline with the red color highlighter, 12 minutes 30 seconds. 12 minutes 30 seconds is the area where, because you have the video again whenever you want to watch the video, right? But my strong recommendation is a running notes is mandatory. Okay, because it's completely your wish, but I strongly recommend a running notes would create a different impact on your preparation. Okay, that is my personal suggestion, because so many of you are asking. So then jumping into PYQs, I want you to solve the PYQs from 2017 to 2004. Okay, exclusively the endo questions. Once you're starting with endo, only endo questions. Endo questions exclusively can be 10 per year. Okay, 10 per year. In 2017, it will be more. Okay, for example, in 2017, the endo questions can be 40. Because we have already discussed 2017 Neet MDS is 8 papers. Okay, so whereas 2018 you will have 10 questions, 2019 you will have 10 questions, 2020 10, 2021 10, 22 10, 23 10. So this turns around maximum for any subject. It ranges for minor subjects, it ranges less than 80, but major subject it ranges from 100 to 120, not more than 100 to 120. Okay, right? So those questions which you are going to do from any of the source. Okay, again, these sources are available on the website also, but website it is combined paper. Okay, it is not subject specific paper. Like for example, if you want, you can solve dental pulse. In dental pulse, it is clearly mentioned as a recent Neet MCQs from 2017 exclusively given, 2018 given. Similarly, any sort of book, whether you follow Neeraj Badwan, whether you follow triplet, whatever book you follow, don't mind. Okay, don't stick on to a single book or rebuying a new book, ordering a new book at this peak time. I don't strongly recommend. Whatever source you have, please try to follow that particular source to finish that MCQs from 2017 to 2024 PYQs. It will be around 100 MCQs per each subject, not more than that. Okay, then jumping into the subject specific exam, which is available on your folder, has to be done. For endo, you have 2 exams. Okay, this turns around how much time it may take. Okay, how much time roughly it may take. Okay, so jumping into the roughly, I strongly recommend endo can be done because it's a first subject. I want you to take 1.5 or 2 days, because first basically endo can be done in 1 day. Okay, but I want you to take 2 days. It's okay, you can take 2 days because it is going to be the first module, first subject. Yes, I want you to take some time. For example, 2.5 hours videos are there. That may take 3 to 5 hours of your time. Solving 100 MCQs, okay, somewhere synopsis reading or explanation reading may take again 3 hours, or again 3 to 5 hours of your time. Okay, because it varies from individual to individual. Some people can cover in 3 hours, finish in 3 hours. Subject specific exam, again, the timeline of the subject specific exam is itself 1.5 hours. For example, you take 1.5 hours extra for the analysis. Okay, this turns around 3. So you can cover a particular subject with a decent amount of reading for around a zone of 9 to 12 or 9 to 13 hours, which is roughly one day. But I told you, right, if you're starting fresh, take 2 days for endo, because first subject should create a very good impact on you. But my suggestion, subject specific examination, I don't want you to compare your scores. Don't compare the scores. 1 day, 1.5 day reading, it's a minimum common sense that you should not compare the scores. The main goal why you're doing this is for a better outcome in the final exam. And trust me, if you do this process properly, there's a high chance that you can easily score 450 to 500 or 550 or sometimes 600 plus in the final exam. I don't want to give a fake promises that you will get an all India GDs or something that may or may not be okay. But I can assure you that you can have a range of 450, 500, 550. Sometimes with extra knowledge or smartness, you can kick that 600 even if you start the preparation now, because the date of examination is not still out. Okay, even if the date is out, we have a minimum of 40 days add on to that particular date. So anyway, it's going to be 40 plus from now, which is sufficient to crack that 450 to 550, even if you start the preparation now. Clear? So I'm jumping into operative. Okay, operative, you have 3 videos available. Same quick revision. You have one exam. Okay, we have one subject specific exam. Then jumping into the pedo, you have 4 bootcamp and quick revision PYQs from 2017 to 2024. And now I want you to give a combined exam. Take some time, revise everything, whatever you have done. You sounds to be familiar with everything, but I want you to revise and give a combined exam. You have a grand exam of endo, cons, pedo for 240 questions. Then jumping into dental materials integrated with prosthetics. Okay, prosthetics. So you have 4 videos. Okay, out of which there is one INICT DM quick revision video, which is taken by Gauri Shankar sir. So please go back and check it. 2017 to 2024, one examination. But make sure, I want you to do extra content, either dental pulse synopsis or power playbooks, whatever that is available, that is comfortable for you. Any one can be done. If you do both, it is extraordinary. It is great. Okay. Then jumping into prosthetics. Okay, you have 3 quick revision videos. Okay, 3 videos available in the quick revision and bootcamp. PYQs from 2017 to 2024. And now I want you to take a grand exam, that is Prostho plus TM grand exam, which is for 240 questions in the Neet pattern. Now, again, I want you to do PP books and dental pulse synopsis for your prosthetic part, because it's a good revision. So once you're done with entire these things, take 1 day revision. Take 1 day revision for all these subjects, whatever you have done, the limited stuff, whatever you have done. I want you to take this module 1 examination, that is ZT1. Okay, make sure, try to contact any of the mentors or try to contact me so that we will have a quick analysis and plan for the next module. Scoring. Okay, it's not about reading, it's about betterment in the score. So jumping into the module 2. Okay, so module 2 is a community. Okay, so my checklist for community is 7 bootcamp series videos are there and 100 question paper, 100 questions discussion paper is there. Okay, where all the numericals, number based, mathematical based, okay, test based questions and everything, concepts are discussed. Okay, well organized video. So please try to finish that 100 marks video. Then PYQs from 2017 to 2024, one subject specific exam. And make sure, I want you to do power playbooks, because especially when I'm talking about fluoride, especially when I'm talking about very, very important dates, very, very important numbers of the community, very, very important indices of the community, or very, very important case activities, and all these are well organized, covered in the PP books. So I strongly recommend you to go with the PP books part of community. Then jumping into radiology, you have 4 videos and you have 2017 to 2024, one subject specific exam. Again, I want you to do PP books along with the dental pulse synopsis for radiology. Jumping into the perio part, 5 videos, PYQs and one subject specific exam. If possible, doing power playbooks part of perio is going to be so wonderful. Okay, jumping into ortho, 6 videos, out of which 2 INICET videos, which are discussed. Most of these quick revision videos are done by Dr. Gauri Shankar sir, and PYQs from 2017 to 2024, one subject specific exam of ortho. Yes, among the subjects until now, whatever I have discussed, ortho may requires more than 2 days. Okay, in module 1 I strongly recommend to spend prosto 2.5 days. Rest everything can be done in 1.5 to 1.5 maximum, or 2. And here ortho may require 2.5 days to this schedule to finish. Okay, right. Jumping into biochemistry, 3 videos, PYQs, uh, uh, yeah, PYQs, and you have one subject specific exam. Okay, you have one subject specific exam on biochemistry, and I strongly recommend you to go with the power play books synopsis along with the dental pulse synopsis of this. Okay, again, take 1 day. Okay, take 1 day, give GT2, and GT3 is a combination of module 1 plus module 2. Take one more day and you can give GT3. Okay, but make sure here understanding the questions or understanding the concepts which are given in the GTs are more important than the scores of GT in this last peak time. So we don't have time to worry about the scores. It is more important is you have to learn the concepts, because final exam score is more important than the GT scores here. Okay, GT scores of course are important for analysis, but particularly for the students who are starting their preparation in the last 1 month or 1.5 month or 2 months, I strongly recommend don't worry about your scores. Try to focus more on learning more, reading more, understanding more, giving more exams, so that your final outcome can be better than your expectation. I hope this is very, very clear, right? So then jumping into module 3, so anatomy we have one quick revision video. Okay, and similarly one histology video, one embryology video, because I see most of the students they ignore histo embryo, which is very, very important. 2017 to 2024 MCQs, one subject specific exam, and dental pulse synopsis is mandatory for anatomy. Then jumping into oral surgery, you have 4 videos. Okay, 4 videos that include medical emergencies and MCQ based videos by me as well as by Sahiti are there, and PYQs from 2017 to 2004, one subject specific exam, and strongly recommend you to go with the dental pulse synopsis or PP books content for surgery. Surgery is very, very important subject, one of the most important subject, integrated subject, interesting and easy to do. Then jumping into general surgery, you have 4 videos, PYQs, and one subject specific exam. Dental histology, 3 videos, of which one video is linked to dental anatomy as well as histology by the mentor. Okay, so please look into that. PYQs and one exam. Dental pulse synopsis and dental histological slides are very, very important. They are very commonly asking. Histological slides, I strongly recommend you to go back, check either Whalers, check either Orbans or 10 kits. Okay, preferably Orbans. Okay, so once you are clear with everything from the synopsis, so then you can keep the textbook. If you want, I can share the PDF of the textbook. Then you can go back and check it. So it's very, very important. So don't ignore it. Last year also we have one question from the dental histology, image-based question. So dental anatomy, you have one video, PYQs, one exam, dental pulse synopsis, and Wheeler color plates are important. Last year you have 2 questions from this area. Every year you have minimum of 1 to 2 questions from this area. So now module 3 exam, that is your GT4 followed by GT5. GT5 includes 1, module 2, module 3. So take 1 day break and try to revise everything whatever you have done. Revision is key here. Okay, revision is key. You're reading quick, but in reading quick also, the important aspect that you have to focus is revision. Before you take any grand exam, 1 day revision is mandatory. Before you take any grand exam, let it be you're taking grand exam 4, revision is mandatory. Grand exam 5, revision is mandatory. 1 day revision. So revision is going to be very, very key factor here, because your preparation is smart preparation. Your preparation is short preparation. Short and smart always requires revision. Okay, so revision is something that you have to carry on a daily basis. If you don't carry revision, then product may be not up to your expectation. So revision is going to change everything. Then jumping into module 4, which is going to be the toughest module. I told you, right? Oral path and oral medicine will do together. So it requires minimum 3 days. Physiology and medicine we do together. It requires 3. Okay. So oral path, oral medicine, two videos are available. And you have PYQs, you have one exam, and you have to do dental pulse synopsis. If permits, power play books are going to be best for oral path and oral medicine. Then general medicine. Okay. So you have 4 videos. Okay, so even 2024, all questions were covered by Pratyusha ma'am recently. So, right, so you have 2017 to 2004, followed by, I want you to do the dental pulse physiology synopsis. Medicine is not up to mark. You can do physiology synopsis. Then after I have few grand exams. Okay, that is one is general anatomy, oral surgery, dental anatomy, CVS grand exam, perio, renal, reproductive, ortho grand exam, and community general medicine, physio, radio grand exam. And everything requires 1 day revision. 1 day revision, 1 day revision. Followed by general path, you have 3 quick revision videos. PYQs from 2017 to 2024, 1 exam, and I strongly recommend you to go back and check the PP books part of general path. Micro, 3 quick revision, 2017, 2024, 1 subject specific exam, and now you have a grand exam. That is general path, micro, biochemistry, 1 grand exam is there that require 1 day revision. Take 1 day revision, revise everything, whatever you have done, then go for the grand exam. Then after the exam, go for the analysis of the exam. Pharmacology, you have 7 boot camp series. Okay, make sure before you start the boot camp series, okay, already the group is going to have the A4 3 sheets which are shared by me on the group. If you don't have, you can ping me back so that I can share you that A4 3 sheets. So take the printouts of that A4 3 sheets and try to finish these 7 videos, which are very, very important. So most of your questions of pharmacology will be from this 7 videos of bootcamp. Okay, PYQs from 2017 to 2004, 1 subject specific exam. So apart from this, there is group of discussions. You have 4 diagram based discussion videos and 3 rapid revision RRR videos are there. So make sure you go back. And similarly, you have INICT quick revision videos which are inclined to Neet. Okay, that is the reason why they are available on your folder. Okay, so make sure don't assume that INICT is not Neet. Okay, so please go back and check those videos. Okay, now you have a cumulative exam on your subject specific folder. I want you to go back and check that. So module 4 exam is GT6 followed by GT6. Okay, I want you to revise all GTs, that is GT 1, 2, 3, 4, 5 and 6, and we have kept a combined GD on the repeats of all the GTs, that is GT7. Okay, so this is the rough plan what I have personally for you. So make sure if you have any considerations, so please do contact me. I'm always available for you so that we can discuss and plan accordingly. But make sure this plan of 4 modules and the videos, 100 plus quick revision videos, and a series of exams, bulks of MCQs, repeats from 2017 to 2024, all these are going to be a perfect packed plan. If you approach it properly, there is a high chance that you can end up with a very, very good score in the upcoming NEET MDS 2025 examination. Okay, keeping that aside. Okay, so this is for keeping that aside. The most important aspect that I want to discuss is the approach towards your exam. Okay, so how you approach towards your exam from now is important. Okay, because you have lots of negativity around you. Okay, because preparation is something like you always try to think on the negative side. Okay, like for example, you read so much, at the end of the day, people will feel that their stomach or the brain is empty. Okay, right, because they always question themselves about the difficult aspect of the preparation, not about the easiest aspect of the preparation. For example, you're reading something like a subject like endo, or subject like an operative or a pedo, or let it be a pharmacology or something. Like, you read so much and you feel at the end of the day, you try to question yourself that if a question is coming from the uncovered topics, what I'm going to do. So this is called as negativity. Like, you're traveling on a bus. Okay, so always we should think that, okay, I'm traveling from here to Mumbai or some place on a bus or on a flight. For example, I take a flight. Okay, so I'm traveling from Hyderabad to Mumbai. Okay, so how I should think is, when I'm going to reach Mumbai, when I'm going to land in Mumbai, and what works I have and how I'm going to finish my works. But what negative people think, okay, is what happens if a flight is going to crash. This is how you're thinking about your preparation. What happens if a question is coming from the areas which I have not prepared for? Okay, the mode of preparation is very simple. Okay, the mode of preparation is assuming that you're reading hard, you're working hard, you're practicing hard, you're revising hard, assuming that the things are going to come from your box. When the things are not coming from your box, no one can do anything. For example, you're preparing for a final year theory examination, which was done recently by most of you, or in the last 2 or 3 years. And you know that once you enter into the examination hall, you have a phobia. One of your friend is going to come and tell that, hey, have you prepared for this question? No. No, that is creating some sort of negativity, right? That is creating. Okay, so such a category of people will be there around you. Okay, on a group or somewhere, like they post a question which no one cannot answer. So that is their way of playing the game. Okay, like I regularly have a friend, okay, very close, one of my close friend is there, my role mate is there. Okay, he always, before we sit and wait for this 5 or 10 minutes before the question paper of theory exam is given, he always pings some bloody unimportant question and asks me, have you read this, this classification? He knows that because he read unnecessary aspects more, maybe, or he read only that particular unnecessary aspect, but he tried to disturb me before I go to the exam. Okay, but my consent is whatever within my box is more important than whatever out of my box, because I cannot do anything out of box. Okay, I cannot do anything out of box. General medicine is something like an ocean. Okay, but I prepared for something which is more important. Okay, and I am assuming that most of the questions should coming from the areas what I have prepared for. For example, if a question is coming from out of box, okay, a question is coming. Yesterday there was some invention, there was some drug, there was some new device, robotic surgeries or plastic surgery, which is out of globe of a dentist who is preparing for an entrance exam. If a question is coming from that area, for 90 to 98%, okay, 99% of the students, it is going to be out of box. So preparation is always whether you are fitting in the competition of that particular crowd or not. It's not about how much you know. Okay, like for example, you see, like getting a great rank or getting a good rank is not about cracking 240 out of 240 questions. Okay, it's about giving your best on that day, and that best may be the best in the entire exam. It's not always mandatory to kick 240 out of 240 to be an all India topper or to be a state topper. It's not mandatory to hit 240 out of 240. If you are best among the people who are in your state, okay, even 180 or 190, even 170 can get you a state first, can get you sometimes an all India first, or can get you a college first rank. You write it, you got it right. So, but most of us has a phobia that we need to hit 240 out of 240, which is hypothetically or practically impossible. So come out of this box. Okay, so for example, like you may come into a clinical practice in the next couple of years, or you may be a PG student. Probably 6 months from now or 7 months from now, you will be having an MDS tag on your nameplate. You will be in a college, you will be with lots of co-PGs, seniors, juniors, staff and everything. And the point here is entire department. Maybe like 9 PGs may be there, 15, sometimes 18. You take some GDCs in the Maharashtra, you have 30 PGs are there, SRs are there. So don't assume that entire department runs on a first year PG. You can give your best, but you are not the one who is running the department. You are not the one who is handling each and every case. It is the entire department which is handling. And for example, you open a clinic in the future, maybe 4 to 5 years from now, most of you may start your own setup, or most of you may fly to a different country. The point here is life always gives you chances. Okay, life is always about giving the best. Giving the best. Whatever you have, you try to give the best. But don't take the superior control on any aspect. Okay, don't assume that you are going to do a monopoly. That's not going to work out, particularly in the field of dentistry. Okay, dentistry is something like we all together, every one of us together is called as dentistry. Okay, so point here to be noted is don't be over involved in the preparation. Don't feel very bad in the preparation. Don't get frustrated in the preparation. Preparation is a very simple game if you play it simple. If you make it complicated, it's going to be a complicated game. Because I have seen a couple of students in the last years who are very good with the preparation, but they have spoiled the preparation in the last couple of months. The reason is they make everything complicated. They get easily disturbed. Okay, they are so sensitive in preparation that someone comes and kicks them, someone comes and disturbs them psychologically, hurts them, posting a question, making them feel inferior. Okay, this is all like spoiling the preparation. This impact become more common in because of the social media, because of this WhatsApp groups, because of this Telegram groups, because of this Instagram, because of this YouTube nonsense and all these things. That's what I'm telling. Like 10 years back, we don't have anything. Whatever happens within the college, whatever happens within the room, whatever happens within the group, or two or three or five or 10 people are reading together. It happens within those people only. Now you have more impact on the social media, which has to be addressed. Okay, so if you stay away from these things, unnecessary negativity things, unnecessary discussions, then the exam is going to be someone in Instagram told this, someone in YouTube told this, someone in Telegram forwarded this. This is not required. This is not required. And you go into your college, this is not required. You go into your hometown or you go into a metropolitan city, start your clinical practice, start consultations. You're least bothered about all these things because you are so busy and preoccupied. Because the more you run, the more you do cases, the more faster you do cases, the more practice it is going to be, the more financial support for you and your family it is going to be. Okay, the more you have to work. So you are coming to that young phase where you have to work more on yourself, in your practice, in your few people, they are not so active in the social media. The reason is they are already preoccupied with their work. They're already doing a great work. Some people, they keep some time for social media or they are completely into social media. That is completely their wish. So this is a very, very important thing that has to be addressed in the last couple of days, right? So please look into this. If you have any doubts, please do drop me so that I'll uh, try to help regarding this. Okay, right? I mean, like, on other hand, people who are preparing for GT8, okay, so GT8 is exclusively everything from GTs 1 to 7, everything from PYQs 2020 to 2024, and everything has to be done in your subject specific folder 2025. All exams, grand, cumulative, everything. And all the questions from GT8 and GT9. GT8 will be on February 12th and GT9 will be on February 14th. All questions will be straight away repeats. Here and there some modifications of the questions can be done related to the classification and everything, but every question will be from the website. Okay, assuming that the date should come before this time. Okay, so by February 14th, okay, deadline I have kept. Okay, and I want you to give this GT8 and GT9. Okay, if the dates are not coming out, my plan is uh, to have our modules are going to restart again. Okay, right? So maybe I'll go with a different combination now. Particularly, uh, it's like 1 2 we have done. Okay, 3 4 we have done. Okay, so in this I'll try to do 1 and 4, because 1 is the most easiest and 4 is the most toughest. So we'll try to do 1 and 4, and we'll try to do 2 and 3. We'll try to do 2 and 4. So different sort of combinations we'll try to do, and we'll try to go to, because this video, the first part is basically layer 1 for the people who are starting it, and the second part I'm talking about, there are many of you, okay, not many of you, there are few of you who has done your layer 1 properly. So now by February 14th, that is 10 days from now, sorry, 5 days from now, if the dates were not still out and if people are still with lots of confusions and everything, what we will try to do is we'll jump into layer 2 reading. Again, you have so many boot camps and everything. I'll be discussing some layer 2 reading, means elaborated, unimportant, minorly important, miscellaneous topics and everything. I'll come again live and I'll try to discuss boot camp again, right? Clear, guys? Right? Right? Okay, so that's what, like, okay, so the upcoming exams live, these are upcoming exams in Mdsconquer. So upcoming exams are your 12th and 14th, GT8 and GT9. So what includes in GT8 and GT9 exclusive, I want you to spend this 4 or 5 days exclusive on all GTs from GT1 to GT7, which are done by you if you're done. All PYQs from 2024 to 2022, and all subject specific folder exams, all grants and everything, what are present in the subject specific 2025. Okay, subject specific 2020, sorry, subject specific 2025 has to be done. Okay, right? Clear? Any doubts? Okay, motto is to help you all. So that's what I'm doing, the productive work from past 10 years. We are done with 10 years. So 10 years of productive work we are doing. And of course, I'm available for most of you. Daily, I'm at least attending 5 to 10 calls and discussing with you. Tomorrow, I said, like, I will be available in the offline center. And you can contact me on the WhatsApp for any sort of things for registrations for the bootcamp series, because the only course that is available in Mdsconquer to prepare for 2025, as the dates were not confirmed as of now, is the bootcamp series, and you can directly register from the website www.mdsexam.com. Okay, bootcamp series. or you can ping to any of the official numbers which are given in the descriptive part of the video, either helpline or my number, so that we will try to guide you. And like before you take the plan also, it is mandatory to come and discuss with the mentor. Watch this video, mandatory. Have a quick plan and discuss, have a 5-10 minutes talk with the mentor, then you can plan. Because you cannot blindly jump and start the preparation and finish the syllabus to get a good rank in the last 40-50 days. It is not that easy, but it can be done if you are guided well and if you are spending time properly. Okay, right. So that is main important thing I want to focus on. Okay, rest everything we can catch up and discuss on the group. Okay, I hope this video is useful, productive, and informative. Okay, so make sure do like the video. Okay, and if you have any doubts or concerns, you can use the directly, you can contact my number. That's not an issue. Or you can use the comment box here. Okay, and share to your friends and batchmates. It may be helpful for them. Okay, so love you all, take care. See you very, very soon. Like, I'm planning to come every alternative day discussing some concepts which will be started probably from tomorrow. Okay, right? And that too, people who are preparing for the PSC also, so please try to attend these live sessions from tomorrow. Okay, so every alternative day we'll be having a half an hour or 40 minutes live session discussing about the key concepts, important areas which are repeated so many times. Okay, the main concept is to discuss few areas and concepts which are repeatedly so many times. Okay, so take care, study well, see you very, very soon. Yeah. Nice. Bye. Take care. I'm available, right? I'm available on WhatsApp whenever you want. You can just buzz me so that we can have a talk. Take care.